Good afternoon, everyone. I am Dr. Sohail Alikal, second year PG resident of Department of Forensic Medicine and Toxicology, AIIMS, Bhopal. Here I am going to present on the topic medical legal issues and trends of autopsy autopsy findings with injection of organophosphates. In this presentation, first of all, I would like to start with a brief introduction of the scenario which is happening in our country. Then we will look at some in detail about organophosphates. Then later we will talk about the medical legal aspects, autopsy findings, and later I would conclude the presentation. As an introduction, the National Crime Records Bureau of India, according to the records of National Crime Records Bureau of India, in 2019 and 2020, the number of suicides in India were 1,39,000 and approximately 1,53,000, of which approximately 25% of which were by poisoning. And various studies in India also shows that of the poisoning cases, for a range of 22 to almost 70% is done by pesticides. And in it is not only suicides, but there have been also cases of accidental poisoning, such as one happened in Kerala, where parathion was accidentally leaked into food particles, and subsequent poisoning were occurred. Moving on to organophosphates, these are widely used as pesticides in agricultural parts of the world. It usually has physical appearance of dust, granules, or liquids, and the absorption of organophosphates in cases of poisoning usually occurs through transdermal, transconjunctival, inhalational, gastrointestinal, urinary, genitourinary mucosa, and direct injection. These are the common sources where we can find organophosphates. Since it is widely available, we can see it in garden sheds, particularly in insecticidal preparations, surface and room spray baits for cockroaches. Example is chlorpyrifos. In shampoos for lice, pet preparations, industrial insecticides, or even it is used in terrorism or warfare as nerve agents. Further, the organophosphates are classified, can be classified according to their toxicity. Here I have highlighted some common organophosphates, which like parathion, which has high toxicity, which is like 50 to 500 mg per kilogram, can cause death in 50% of the cases, and chlorpyrifos and malathion, which has moderate and low toxicity. Moving on to the medical legal aspects, as a general guidelines for all types of poisoning, if the case comes to our institutes or our health setups as an emergency, the first priority should always be resuscitation and stabilization, and the consent should always be implied in these emergencies. And registration of MLC and police intimation is mandatory under CRPC 39. And the failure to do so may invite persecution under Section 176, which has a penalty of up to 6 months or 1,000 rupees fine, or both, or under Section 202, which has a punishment of up to 6 months fine, or both. And also the discharge, transfer, or death of the MLC case should also be informed. Moving on to the medical legal evidence handling in cases of suspected poisoning. The main articles which should be preserved are gastric lavage, gastric contents, vomitus, and the clothings the suspect or the patient was wearing, or any other relevant body fluids. The fluids collected should be preserved and handed over to investigating authorities, and it should be identified, sealed, and labeled properly. A failure to collect or destruction of loss of such an exhibit can be punishable under 201 of IPC. Here, the punishment is according to the offense which is being committed. That is, if the offense is punishable by death, the person who failed to collect or causes the loss of this exhibit can get a punishment of 7 years plus or minus fine, and in life imprisonment, and punishment less than 10 years, it can be up to 3 years and up to 2 years of imprisonment respectively. And moving on to autopsy findings. In autopsy findings, these are the expected autopsy findings, which are in external findings. We are more likely to get an characteristic odor of garlicky or kerosene-like smell, which is attributed to mostly to liquid formulations of organophosphate, because it is mixed in kerosene or other petroleum products. And others are frothing at mouth, cyanosis of extremities, and constricted pupils. And in internal examination, congestion of GI tract, the garlicky odor of contents, pulmonary and cerebral edema, and general visceral congestions are seen. In our institute, we had 3 autopsy cases of confirmed organophosphate poisoning. And in 2 of these cases, the patient died in 1 day, and one of the cases the patient died after 4 days of treatment. But in these cases, we were not able to find the expected or the external findings. Here, the external findings which we expected were either not appreciated or it was not present. These were the cases. And in internal findings, we were only able to find generalized congestion. There were no specific findings which could be attributed to organophosphates. These are some pictures of the internal organs, and these are the stomach contents. Also, it is said that some of the industrial organophosphate has a greenish coloration added to it, so we may get a greenish colored content, but it was only one case in the 3 cases where had this presentation. And moving on, in conclusion, since the organophosphate cases have a non-specific autopsy findings, the preservation of evidences is important for identification of compound. So we have to keep in mind that it is more important to preserve the evidences much more than that of autopsy findings, and mostly the compounds are confirmed by doing analytical techniques such as chromatography. These are my references.